it's Sarah from Sarah Gale Nutrition here, and this week I'm covering my most frequently asked questions, common myth-busting answers, and the biggest oh my god moments my clients get in clinic. So have you ever wondered what is normal and what is not? So as women, we're fortunate enough that we do talk a lot more with our friends than our partners may feel comfortable doing. But have you ever wondered what actually is normal? Your friend might have a similar problem to you, which can feel comforting that you're not the only one, but actually, is it normal? And even what is normal? We could, of course, argue that we're all unique, so actually there is no normal. However, there are certain points that I hear all the time in clinic that are common, but they're certainly not normal or healthy for the body. So I thought I'd collate them into one handy post. So here goes. The first one is you should pass a stool at least once a day, and it should be easy and you shouldn't have to force it. So poo is a subject that makes us, a lot of us, a little bit squeamish, and is probably, unless you are me, not the topic you would freely discuss with your girlfriends over a coffee. So the liver and gut work closely together as major detoxification organs and routes in the body. Our toxins, our hormones, and other substances all get detoxified by the liver before being dumped into the gut to be eliminated by the stool. And this is one reason why it's really important to pass a stool at least once a day, because you're literally pooing out the trash. Not only should you pass a stool at least once a day, it should be easy and without the help of your morning coffee. You shouldn't have to strain, push, or sit there willing for your body to release. It should be an easy, swift experience. And the sign of a healthy stool is mid-brown, smooth, and sausage shaped without lots of cracks. And if this isn't you, then this is your number one priority to get this sorted as soon as possible. So constipation is classified by a difficulty of either passing a stool, feeling incomplete or unsatisfied after passing a stool, or not passing a stool regularly, so at least 3 days in a week. It can be a huge contributing factor in things like bloating, gut cramping, and gut distension. It is also the first place I would start when looking at rebalancing hormones, because used hormones are again excreted via the gut. So you really want to use your hormones and you want to lose them. Gut testing can be incredibly helpful to understand what is happening in the gut and address any imbalances. However, there's lots of things we can still do without knowing what is going on in our guts to help encourage a bowel movement. So making sure you're adequately hydrated throughout the day, getting in some daily movement, and upping your fibre is a great place to start. I just want to put in a quick note about fibre. For some people, actually increasing fibre can actually worsen their constipation, and this can be a sign of a gut bacteria imbalance in your gut. So this is where gut testing would be really important to understand what gut bacteria are present, what might be contributing to that, and in what quantity, so we can get a really targeted strategy to help resolve that. Number 2, PMS, heavy or painful periods are normal. So you could review your period as a monthly health report card, a monthly check to see how your health is generally, as well as our period really should be something that comes and goes without too much discomfort or change in how we feel. And actually, I find it incredibly disheartening to hear almost every woman suffers with difficult periods of PMS, and hear them say that it's just part of being a woman, I've just got to live with it. And whilst it's incredibly common, it is not normal, and it isn't something we have to put up with just because we are a woman. So it also isn't normal to have to go on the birth contraceptive pill to fix your periods. More coming up on this in a little bit. It isn't normal to experience heavy bleeding. It isn't normal to have to take a day off work because the cramping is so bad. It isn't normal to have to take ibuprofen to get you through the first couple of days of your period. So your period should arrive smoothly, regularly, and without really many symptoms at all. And if it isn't you, then I'd encourage you to become your own detective. So start by tracking your cycles, paying attention to what symptoms you have and when in your cycle. I'd also really encourage you to reach out and get some help. So consider testing your hormones or working with somebody, actually me maybe, that can really get to the bottom of what is going on with your hormones. Number 3, your TSH blood levels are normal. So this means your thyroid function is fine. I think this is probably my biggest bugbear. So thyroid hormones are produced in a cascade, starting off with thyrotropin releasing hormones, so TRH, in the hypothalamus, a portion of the brain. This then stimulates the production of thyroid-stimulating hormone, TSH, in the pituitary gland, which is another part of the brain. TSH then goes on to stimulate the release of thyroxine, also known as T4, and I'm not going to pronounce this one, but T3, and T4 and T3 are produced in the thyroid gland. TSH, T4 and T3 can all be tested really easily in the blood, but often it's TSH that is tested to understand what is happening with your thyroid, and T4 if you're lucky. But knowing your TSH levels and your T4 levels is just not enough to understand how well the thyroid is functioning generally. So T4 and T3 are the two active hormones. T4 is a very weak action, whereas T3 is very potent potent. And I like to use the analogy of T4 is like putting your foot on the accelerator of if you're driving a car, and T3 is like putting your foot to the floor, so really revving you up. And T3 is what really revs up and our metabolism and moves our body. So if you've had your TSH levels tested and been told everything is normal, unfortunately that you don't actually have enough information to make that call. Understanding what your TSH levels are is important because it gives you information of what is happening between the pituitary gland and the thyroid gland, but it doesn't actually tell you anything about what is happening on a cellular level and what your levels of T4 and T3 are. I also want to question what normal is. So GPs typically use a reference range of TSH anywhere between 0.27 and 4.2. This reference range or similar reference range was based on scientific research from people with thyroid function. So the reference range, when it was defined, wasn't based on a healthy person's level. It was defined based on what a person with thyroid dysfunction level should be. So this resulted in the reference range being set far too wide. And whilst it's been noted by many researchers, scientists and specialists since the reference range was first set, unfortunately the reference ranges haven't been updated across the board. Just for reference, if you have had your TSH levels tested, I would like these between 1 and 2 for optimal function, so a lot smaller reference range. So if you've had your thyroid tested and been told it's normal and within the reference ranges, but you still feel like something's off, you still don't feel right, question it. Get a copy of your blood test results. Check what has been tested. Have you had the full panel? Probably not if it's done by your GP. And check, are you within the optimal reference ranges? Do not just take being told everything is normal and fine if you feel differently. Number 4 is the birth control pill fixes hormonal imbalances. And I think this is probably the biggest oh my god moment that my clients get in clinic actually. So I think I'd really struggled to find a woman born in the last 50 years or so that hasn't taken some form of birth control, and not just for contraception. So I was first prescribed the hormone contraceptive pill at 15 because I had irregular periods and painful periods, and they were heavy as well actually. I hadn't had sex, but that was the only option I was given to sort out my periods, fix my periods, and I know I'm not the only one. So it's often a misconception that the birth control fixes our hormones, because when actually for some women, when starting to take the birth control hormone contraceptive, then actually your symptoms can go away, so it can feel like they're fixed, but it isn't actually fixing anything, it's just masking the symptoms. So birth control works by suppressing the natural production of our hormones, so you no longer cycle, and as production is suppressed, you don't get the benefits from of the hormones of estrogen and progesterone, which is really important for things like mood, bone health, muscle health, metabolism and thyroid function. So it is also poorly explained that the hormones you're taking through hormone contraception are the same as your own hormones. They're not. They're synthetic versions, which is why you don't get these other benefits as well. I think it's also a common misconception that actually if you are taking birth control and you have a break and you have a bleed, this isn't actually a period, it's just a withdrawal bleed. So you don't always ovulate whilst on birth control either, which often isn't explained to you. I want to make it clear I'm not anti hormone birth control, hormone contraceptive pill. I'm not anti them, and I believe that everyone should make their own choice for what is right. And in some instances, when you suffer from maybe something like endometriosis, then actually the birth control pill might be necessary and it might be what you need. There are lots of other natural options as well, but actually maybe you need the birth control alongside. However, I do strongly believe that it should be clearly explained that going on the hormone contraceptive pill is only for preventing pregnancy, really. It is not fixing anything with your period, and it might actually cause you difficulty later on when you come off the birth control pill. So for example, you want to get pregnant, you want to take a break, or it's just not working for you anymore. And there's many other natural solutions that actually do work on fixing your hormones and can help with things like PMS, heavy or painful periods. And the contraceptive pill is not the only option. Number 6, and the last thing, is it's normal to be tired as we age. So hands up if you think it's normal to have less energy as you age. And I'm really speaking to all of my peri and menopausal ladies here. And I hear so often that actually, oh, maybe it's just my age, I'm getting older, maybe that's just how it is now, my body feels a little bit broken. But I'm here to tell you that you don't have to settle for less. That is not the case. It is normal that our energy levels do decline a little bit as we age. And we can't necessarily expect the same energy levels that we had as a child or teenager, depending what our health was like back then, actually. But as we age, our muscles can start to lose strength, they become less flexible, as well as a reduction in the amount of blood that's pumped around the body, which can contribute to sort of lower energy supplies and feeling a little bit more lethargic. But it's only a slight reduction. That doesn't mean we should be tired, exhausted, and feel like we're dragging ourselves throughout the day. Hormones can contribute greatly to our energy levels. So actually going through the perimenopause and menopause period, then actually your hormones can be contributing to a lower production, lower amount of energy, as well as things like our diet, how much we sleep, our stress levels, inflammation, hydration levels, and what our metabolism is like. Gut bacteria as well. So there's so many things that can contribute to lower energy levels. So if you aren't satisfied with your energy, you don't have to live with it as you age. It is possible to feel better than maybe you did during the previous decade. And actually, number 7, which is a bonus one, is bloating is not just from what we eat. So if you suffer with bloating, I can pretty much guarantee you've racked your brain as to which foods are causing it. Maybe you've found some culprits, but I bet that it doesn't always happen. Like when you eat that food, it doesn't always happen. And for some reason, things are sometimes better or worse than you expected. So certain foods can absolutely cause bloating and generally do in all of us. So things like artificial sweeteners, they can't be broken down by the body. So actually the gut bacteria ferment them, which creates gas, which is going to contribute to bloating. Other foods, depending on what your gut function is like, your gut bacteria, your genetics, can cause more bloating in some people than others. So food absolutely can contribute to bloating. But if it feels like you can never quite work out which food to cut out from your diet to improve your bloating, maybe you need to consider other factors. So the biggest factor I actually see contributing in bloating is not breaking down food well enough. So it might look a little bit like this in your everyday life. So you don't have time for lunch because you're so busy. You grab something quickly at your desk while you work. You're focusing on replying emails. You're bent over, leaning into the screen. And before you know it, your lunch is gone without really much memory as to what it was, what it tasted like. And then about 30 minutes, it starts to feel a little bit tight and uncomfortable around your midriff. And you sneakily undo your top button under the table. It might not look exactly like that, but that is generally a pattern that I see with office workers and people that suffer with bloating. And I say not breaking down food is the biggest factor that I actually see more than food. So our digestive system is set up with many different tools and techniques to help break down our food in order for us to be able to digest and absorb the nutrients that we need to survive and live. So things like our teeth, saliva in our mouth, stomach acid, digestive enzymes, bile produced from the gallbladder and liver, as well as like the muscular contractions that happens in your gut. They all work to help break down your food. So if this doesn't all happen appropriately and in the right place of the digestive tract, then actually our gut bacteria can get hold of undigested food and really start to ferment it. And this is when things like bloating, cramping and general gas can come into play. So what can we do? We're chewing our food thoroughly, being present when we eat, eating slowly and mindfully, and sitting upright at a table without distractions are the best things we can do to help reduce our bloating, as well as other gut symptoms as well. These things really give our digestive system a fighting chance at breaking down the food appropriately, which then reduces what our gut bacteria have to ferment, which helps to reduce gas and reduce bloating. So it might not be about finding a certain food and keeping a really detailed food diary and stressing about what one particular food it is, but instead how you're eating generally that can help to improve your bloating.